I think find the right organization that prioritizes and values a diverse workforce, because realistically, that's where you know that there's going to be a lot of effort and attention paid to your well being.
Hi, everyone. It's Vrushangi Shah with the Fellowship Review through the American Journal of Healthcare Strategy. Today's episode is extremely special for me because not only do I get to introduce a good friend, but also a fellow coworker and former fellow at the same organization where I did my fellowship, but no spoilers yet. So I'm going to welcome Smirthy onto the episode for today. Thanks for joining me. And why don't you kick it off by telling our listeners a little bit about yourself?
Yeah, thank you for having me. I am so excited to have this conversation with you and for everyone. My name is Smirthy. I am a program manager at UCLA Health currently, and I work for the Hospital Cancer Services Department. So not only are Vrushangi and I friends, but we also are colleagues and peers because we work in the same department. I am originally from India. I was born and brought up in India, and then I moved to the US in 2015 for my undergraduate studies in biochemistry at Earlham College. And then I spent a couple of years working in research and subsequently got my MPH in healthcare management at Yale University. And like Vrushangi alluded to, I used to be the administrative fellow in 2023 through 2024. And I am really excited to dig right into the details of my fellowship.
Yeah, and what an incredible journey, which I'm definitely going to be highlighting and calling out. But, let's start with the fact that, international student were able to navigate the undergraduate kind of journey. You also successfully navigated the graduate school journey. And a lot of our listeners know that a big part of graduate school and also just, being a higher ed student in the US is internships. And, you had first of all, you had incredible research assistant roles throughout your career, but then two internships that I really want you to speak on and educate our listeners on are the graduate intern role that you did with Yale Hospital, and then also the grad intern role you did with UC Health in Fort Collins, Colorado. And so why don't you tell us a little bit about both of those experiences, some unique things, projects that you want to highlight, and what that was like?
Yeah, I think the first thing that I'll say is internships are so critical for any of your programs, but particularly in grad school. And I know that international students have a lot of challenges in navigating those internships. A lot of the times, due to the lack of understanding on the employer side of what an international student can or cannot do. So, in terms of navigating the landscape generally, I spent a lot of time at the office hours for my international student advisors to be like, hey, what is this process? What does a CPT mean? What does an OPT mean? What can I do? And I often played the role of the translator between the international student office and the employer I was applying to, where in my interviews I would highlight, hey, I'm an international student, but also you will have no issues for me working for you temporarily because of all of these legal provisions that the government has made. And so that's a comment on the overall logistics of the operations. But in terms of the internships itself, I was incredibly privileged to work at two major health systems across the country in various departments, either during a summer internship at UC Health in Colorado and Fort Collins, where I was the only graduate administrative intern in my cohort who was in the northern region, and which meant that I got a lot of mentorship from the COO of the hospital, Ryan Roman. I spent time working on executive leadership projects. So I spent some time working on updating our on-call policy, especially coming out after the pandemic, where we were trying to look holistically on what are all the different services that have on-call coverage currently? What is the utilization, and how do we make sure that we're appropriately aligning financial resources, on-call resources to what the patient demand is? And so that was a incredible project I got to participate in, and in trying to understand not only the operational elements and the patient care elements, but also some of the financial analysis that goes in that process. And the other project I worked there on, which I also want to call out, was UC Health is very committed to supporting leadership and making sure that senior leadership is actively participating in active daily management within the organization. So I learned a lot from UCLA Health, hint, hint to why I applied in the future, on how we embody daily rounding and senior leadership rounding systematically within the organization. Those were my two big projects in my summer. And then I did a practicum, which is Yale University, which is where I got my graduate program, went to graduate school. They have a 1 to 2 credit course that you can take in during the course of your semester, where you work with different organizations in Connecticut and the tri-state area
Mm.
for getting some real life experience in working in health administration. And so I was lucky enough to work with the anchor mission strategy for Yale New Haven Health System, where I worked with the VP of Health Equity at the time to develop the different pillars and like systematically add different initiatives to the different anchor pillars. You can look up the Anchor Mission Network if you're very curious about health equity. Rush started it, I believe, to come up with a way to embed big health systems like UC Health, like Yale New Haven Health and UCLA, to invest in the community and build the community from the ground up, in addition to providing healthcare. And so I worked a lot on inclusive hiring practices, and I learned a lot from the team, and I'm really grateful for that experience.
Yeah, both of those experiences, sound so incredible, and I so appreciate you adding that international student perspective. So please feel free to do that for the rest of our recording, because I really do want this episode to benefit anyone interested in Yale or UC or UCLA, but especially international students, because I think there is an added layer of difficulty to your journey in acquiring things like a fellowship. And so moving right along, you incredibly accomplished and intelligent individual. You had a lot of paths that you could have taken. You could have been a consultant, you could have gotten a job, you could have gone back into research and science, but you chose a fellowship. So tell our listeners, how did you find out about administrative fellowships, and what ultimately led you to apply to one as opposed to all the other options you have?
Yeah. And for full transparency, I applied to both consulting roles and to fellowship roles, but ultimately ended up choosing the fellowship because I felt like it most benefited my path, and I'm happy to delve into the details. But I am incredibly privileged that Yale School of Public Health has a very strong career development office, where we have folks in the School of Public Health team who will meet with all of the students in the program and sort of help shape their careers by giving them advice on what are all the different things available. By attending, we were as part of our requirements for graduating, we had to attend professional development series. So we had resume building workshops, we had career coaches who came and talked to us about the different pathways. And so I think I had a lot of systematic support in figuring out which path was right for me. And my internship at UC Health in the administrative landscape really solidified my interest in pursuing something that was healthcare administration. But then, to exactly your point, we had consulting or fellowships. And I didn't want to limit myself at that moment, especially because I'm an international student and I wanted to make sure that I got the right training under my belt. And so I took a shotgun approach where I applied to both of those, but I was really picky. So I chose different industries, but I was selective in how many or what programs I applied to.
Mm.
And so with that, I think the fellowship really gave me an understanding of, well, I want to be in the provider space and I want to become a lot more knowledgeable in this area. But then
Sure.
again, in hospital admin, there are so many different facets that you can go into. You can go into risk, you can go into operations, strategy, finance, quality. You have all of these different buckets, and I didn't know where I quite fit in. And I think a fellowship allowed me to get an exposure into all of those different areas, do projects across all of these different areas, and then get myself time to get acclimated to those and figure out where exactly I wanted to be. And so that's the decision I ended up pursuing.
Gotcha, gotcha. And I'm so glad you ended up coming towards the fellowship side because then obviously we got to meet each other. But, let's take a step into that process then. Fellowship, the entire process is incredibly competitive. It can be very, challenging at times, but very rewarding. So, what was that like for you? I know you mentioned you had a great career center. You also were very selective, but if you're willing to share, what was the fellowship application and interview process? Maybe what were some things that surprised you, and kind of what ultimately led you to pick UCLA Health?
Yeah, I think yeah, in terms of the fellowship application process, I was late-ish to the game. I was still in the middle of my internship, and I know so many folks that are in my class even started working on their personal statements way in advance. But I took my time in making sure that I was set on applying to fellowships, and I think in terms of like the application process itself, I did a lot of homework. Even though I started late, I spent a lot of time meeting with folks from different organizations, meeting past fellows, or combing through the websites, or talking to my classmates who did internships at all of these different areas. And I felt like that really furthered my understanding of what a fellowship is like and what an organization is like. Because ultimately, I only applied to 4 fellowship programs, which is very small. And UCLA Health was the only fellowship I applied to on the West Coast, and then I applied to one in the Midwest and 2 in the Northeast, because I was pretty picky about geographical locations. I wanted to be in a major metropolitan area. I wanted to be in an academic medical center, and I wanted to be in an organization that um, emphasized the humanity in healthcare. And I think UCLA Health was the organization that did it the best. And so when I was applying, I did a lot of research. I spoke to a lot of people, and ultimately picked the 4. And I think in terms of how that worked out, I think it worked out really well. And I think a lot of it because there was that alignment between the places I applied to and what I believed in personally, and what I believed in the mission for healthcare. Um, because I would have happily taken a job in any of the 4 organizations, and I obviously preferred UCLA Health. That was my number one, and so I'm just really glad that it worked out that way.
Yeah, absolutely. And I think one thing I'll draw attention to in your last answer that you said that I always draw attention to anytime a guest mentions it, it's the fact that it's a good thing that you're selective with your locations because you have to live there. So I think there's a lot of value in not just picking organizations for their name, but rather understanding that you may be building a life in this city or town, and if you're going to spend 40 hours a week or whatever at work, there's still your evenings and your weekends, which you'll spend outside of work. And it's important for you to be able to like that place and build community there. So appreciate you, kind of highlighting that you were very selective with the cities that you picked for your fellowship. So that's good advice.
Mhm.
Um, and so we arrive at your fellowship, and of course you're several months out of your fellowship now, so new to your program manager role, of course, but you have your fellowship checked off. um, Tell our listeners about first, the UCLA Health Fellowship, logistics wise. For those that listen to my episode, this will not be new information, but for our new listeners, tell us, is it 1 year, 2 year, project based? rotation based? And what is kind of the logistics around how the fellowship is structured?
Yeah, I think, and kudos to the fellows that preceded me. Hint, hint, Vrushangi. I think our fellowship program and our onboarding is incredibly well structured. We are a 1 year project based fellowship program, primarily within hospital operations, but that's not a limiting factor. While we do most of our day to day under the leadership and preceptorship of Drew Weil, who's the director of hospital operations, we do projects sort of across the enterprise and across the 3 flagship campuses and the 250 plus ambulatory clinic networks that we have. And the process itself is very, very, I call it the white glove service of fellowships, because um, there is someone guiding you along that process even before you come to UCLA Health for your program from the get go. I know, Vrushangi, you and I met on a monthly basis leading up to the fellowship, where we talked all details about what the program is structured like, what housing looks like, what the different resources we have access to, and so on and so forth. So I think in terms of that, there's also a lot of guidance. And in terms of the project work itself, I would say it is a guided pick your own journey, in that there are all these different areas and trajectories you can go down, but they're not a wild goose chase. So, for example, I wanted to work primarily in our service lines. So UCLA has 4 primary service lines. We have oncology or cancer, we have ortho neurospine, we have transplant and cardiac, and then we have women's and children's services. And given my previous experience in research and during my internship experiences, I really wanted to get a clearer understanding and a lot of experience under my belt working with our service line directors to understand how we do inpatient outpatient coordination and how we make sure that a patient's journey is seamless. And so I spent a lot of my time in projects there, but I also did projects in strategy and some that were business planning and finance. And in each, there are people who are bought into the fellowship program. Our senior leaders really are intimately familiar with the fellowship program. And so you get paired with someone in a different department or a different team, and you work with them for your projects, but then you come back under the leadership of operations to figure out what your next steps are. And they're the people that you go to when you want to sort of unwind some of the kinks or problems that you encounter along the way.
Yeah, absolutely. And I think, shout out to Drew. But having a preceptor who also was a former fellow, and then having a strong fellowship network of previous fellows so willing to help the new fellows is what I think made your experience, but also my experience, so special, because the fellow before me, Aubrey, incredible, really helped me get settled way before I even started at the health system. And so, thank you for giving us that overview. And I know in your response, you kind of listed off various areas that you worked in, but any specific projects that you did during your fellowship that you want to highlight that really stuck out, or what were like a good experience for you as a fellow?
Yeah, I think this, going back to the earlier question of why a fellowship versus a regular job, I think is because of the kind of magnitude and scope of projects that you get to work on as a fellow, that you sometimes get shielded off from when you're doing a job that isn't a fellowship. Ultimately, the purpose of a fellowship is education and mentorship. The projects, I think, are a great value add for both the organization and for yourself to sort of get that experience. But the most is where you're in the weeds learning as you go.
Mm.
And so I want to highlight a project that is, I think, a career project for a lot of folks. They wait their entire careers to do something that I got a chance to be a small part of, which was the operations transition of the UCLA West Valley Medical Center, formerly an HCA hospital by the name of West Hills hospital. And I was working very closely with our senior leadership, operations, finance, human resources, quality, strategy, to track all of the milestones, which incredible feat that we were able to pull off in 90 days of getting a fully operational hospital and transitioning that to a UCLA Health facility without compromising the high quality patient care that we're really known for at UCLA Health. And so I did a lot of work in making sure that nothing falls through the cracks, whether it be linen services or whether it be making sure that there's transportation, making sure that our employees, the new employees at West Valley, are able to get their meal passes by swiping their badge. And so I wasn't the person who was doing all of these because they are
Sure.
way out of my expertise zone, but I was sort of project managing the entire transition. And that was quite an experience. I think I was incredibly surprised that I that we did that and did that without breaking into too much of a sweat.
Yeah, absolutely. No, incredible experience. And you did mention this and it set us up perfectly for the next question that I want to ask. A big reason, and you already said this, but a big reason students end up a lot of the time pursuing fellowships is because, the access and exposure to incredible healthcare leaders and mentors in a specific health system and honestly even across the US. So what was and for us mentorship was very different fellow to fellow, so speak a little bit about what mentorship was like for you, not only with your direct preceptor but also with the various leaders you had the opportunity to work with throughout your fellowship.
Yeah, I one thing that I will say right off the bat too is, and I learned this during the fellowship, is mentorship doesn't always have to be formal. It doesn't
Mm,
always have to be a meeting. It doesn't have to be a standing calendar check-in. I think it's great if they happen to be how your approach to mentorship is, but a lot of the times, informal conversations when you pass someone along the hallway, or the conversations that you have after the meeting has completed and you're all heading back to the office, I think can also be incredible gold mines for getting that knowledge, because a lot of the leaders, and I think across different health systems, particularly at UCLA Health, are world renowned in their field, and they're so humble and eager to share some of those experiences, that I think it's about finding the right moment, whether it be formal or informal, and then asking the right question that I think really makes that conversation a meaningful one. And outside of the direct preceptorship and sponsorship that we get from the COO of the hospital, Richard Azar, and Drew Weil, who is the director of hospital operations, I also was incredibly lucky to be under the guidance of various leaders across the health system, both in hospital operations, but also in other departments. A lot of them happened during our meet and greets. So we, as at UCLA Health and across other fellowship systems, your first few weeks are, think of it like a speed dating, but for meeting healthcare executives and learning more about what they do. And so my co-fellow, shout out to Alyssa, who was incredible, and I did a lot of these meet and greets where I felt like, oh, I've asked a lot of great questions and I think I've learned a lot, but I'm not like I think there's more and I want to learn more. And so then I reached out to the director of general services, Norm, that the chief pharmacy officer who also interviewed me, and other leaders, including the service line leaders that I had a working relationship with in projects, who I met either for updates on projects, and then we had
mm,
conversations after, or either asked questions in passing, or had standing time on the calendar every quarter. So I had a all size fits approach that was really valuable. And we talked mostly about informal things. We talked about what was happening in our lives, what life in LA is like. But even in those moments, I think you get an understanding of how they approach leadership and how they really guide you into all of these different experiences without ever making you feel like you're on the spot. And I think I learned a lot from that. And then the network of past fellows, including you, Vrushangi, I think I learn every day from, and I think it makes mentorship not something that's daunting or formal, but way more approachable because ultimately it's about finding people that you admire and asking them, well, how did you get there? What and learning more about their journey. So it's about that personal connection.
Yeah, absolutely. Absolutely. Thank you for sharing that. And again, you finished the fellowship and of course you stayed at UCLA, which we love. Tell our listeners, what do you do now? I know you're only a couple months in, but remind us what your title is and also what does that entail?
Yeah, so I am now started in August. I'm sorry, my Teams keeps going off because but anyways, so I am the program manager for hospital cancer services, which are all hospital licensed services that a lot of our cancer patients who have cancer utilize. And so, what that entails is I do all of the business planning and expansion initiatives for all hospital based infusion areas. I also manage, as part of my responsibility, the adult hemoglobinopathy program, which includes diseases like sickle cell and making sure that patients who have sickle cell have a seamless experience in making sure that all of their healthcare needs are met, as well as working on different transition initiatives for the newly acquired UCLA West Valley system. And so I think the great part about this role is that it has a lot of potential and areas to explore into. I remember during my first one on one with my manager, she asked me, "What do you want to do?" And I said, I want to do everything. I am new to the oncology world. I have so much to learn and I want to learn it all. And the great part about working for hospital cancer services is we do almost everything and a lot because not only is our oncology centers and infusion centers serving patients with cancer, but it's also meeting the needs of other areas that have specialty infusion needs. And so I call it I dub it the mini fellowship experience where I'm not doing everything across everywhere, but I get to dab in a little bit of everything that is under the footprint of cancer.
Yeah, absolutely. No, it's been incredible, watching you through your fellowship and now acclimating so quickly and so well to your new role. So I'm excited to kind of follow your journey as you get more and more comfortable in your role. But the two questions that I love to kind of end all of my episodes with, which I'm absolutely going to ask you, Los Angeles, big city, diverse, very different than a lot of places around the US. And of course, you've moved around quite a bit in your life. So maybe you're better at this than most. But, oftentimes your fellowship requires you to move cross country, which of course you did. So, what was that transition like? What is something you want to share with our listeners from your perspective about living in Los Angeles and adjusting from, the East Coast to LA and to California in general?
Yeah, you and I have talked about this a little bit too. I wasn't convinced I was going to make it in LA because I moved here never having driven myself anywhere. I got my driver's license a month before I moved to LA, and LA notoriously and maybe incorrectly is seen as a driving only city. And I was very nervous coming in. Especially because I'm used to a pretty autonomous life. I moved I went to boarding school and I have been living independently since I was 14, no, 13. And so I was like, well, I don't know how I'm going to get around LA and is that going to really hamper my style? And luckily for me, LA is a beautiful oasis that really lends itself to exploration if you give it the chance. And I think that's what I've learned is I am incredibly lucky. I cannot emphasize that enough that I came to LA in the right place and met the right people, either at work and in our friendship or by really putting myself out there. I remember I go to the farmer's market. I kept seeing the same person in the farmer's market like 4 times in a row. And I was like, hey, I think we live close by to each other, which again, in hindsight, seems a little excessive. But again, like, I think we really formed a friendship out of it. And I tried to immerse myself in activities in the community. I do stand up. I met my big group of people doing stand up in LA. I tried volleyball, will not do it again, but I met folks there. And I think really LA is a city where I think, unlike the East Coast, you really get the sense that people here are also really eager and willing to engage with you. And if you just look past the perception of what LA is like, I think it's truly
Yes.
a magical city. And you can navigate public transportation pretty easily here. And so you can drive, and I think it makes your life much better if you drive, but you don't have to. And I think it's really about finding the people. And I know that it's really hard, but I think I also serendipitously and also by trying really hard found a really good group of people. And I think it's made LA really beautiful.
I love that. No, LA, I think the way I see the city is that there is something for everyone. You just have to be willing to go out and find it. It's not going to come to you. And the last question, I tend to end on this one. Hindsight is such a gift, and when you look back, you get a full understanding of an experience and life in general. And so now for you, when you look back at your fellowship application cycle, the journey that you went on, and of course now the completion of your fellowship, any advice for people pursuing this path, specifically international students, anything you would change about what you did?
Yeah, I think, and this is a shout out to all of my international student folks. I know that employment after graduation is something that is really tricky to navigate as an international student. And I really empathize and understand your struggle. And with that, I'll also say a lot of the times, leading with honesty for me was the biggest. I always said, I'm international. I don't need visa sponsorship now, but will require one in the future. And here are all the things that all the experiences I bring to the table. And really, at least for me, and I think it's true for a lot of the different folks here, everyone's really talented and bring and add a lot of value. And it's really in communicating what that could be or what that future could look like. And so highlight your story in your interviews because the right organization will really care about that and make sure that, like UCLA Health very graciously and incredibly supported me through my journey of navigating employment after the fellowship and making sure that all of my paperwork is in place. And so I think find the right organization that prioritizes and values a diverse workforce because realistically, that's where you know that there's going to be a lot of effort and attention paid to your well-being. But in terms of the application process, I think this is something that we tell all the folks who apply for fellowships. Really, fellowships are really competitive. There are a high volume of applications that come in. And ultimately, what makes you stand out from another candidate who went to an incredibly reputable university and has an
Mhm.
incredible list of experiences is really your why and your story. Because
Absolutely.
ultimately, what you bring to the table is really unique. And the more you're able to convey that story, I think the more likely it is that someone else picks up what you're putting down, right? And
Yeah.
so, yeah, that's my big advice: is stay true to who you are and try to share a story that strikes that connection to someone else's humanity. I think that's really critical.
Yeah, all great advice. And like I said earlier, I'll just repeat it. Appreciate the international student lens because, again, I don't want to minimize how difficult the fellowship journey is. It's not, it's very, very difficult. But I think there is an added layer of things you have to pay attention to and be mindful of when you have that kind of label of international student as well. So I truly appreciate, your perspective. And of course, this is biased, but this episode has been so fun with you. And I know that, it's going to be incredible for traditional applicants and fellows. It'll be helpful for international students. So I'm really excited for, the release of this episode. But thank you for your time. And I really enjoyed talking to you tonight.
Yeah, how exciting that we get to do this. And for everyone listening, consider UCLA Health. We have good people here.